Hi, this is Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education related for pain management. Today I'm out in North Scottsdale at DC Ranch. Gorgeous area with a lot of restaurants. There's a wine bar called Armitage. Beautiful water feature out here. Very attractive little oasis in the desert. The topic today is fungal meningitis. I wanted to describe the current outbreak in the United States. Now, let's be foremost up front. Arizona is unaffected. There have been no cases in Arizona at all. Arizona Pain Specialists has had no issues at all with fungal meningitis. The whole state, actually. I don't know if anybody even receives the medication from the source. So, what is going on? It's amazing, actually. The risk of an infection from an epidural steroid injection is less than about 0.1% normally. Okay, it's a very low-risk procedure. People benefit 75, 85, some studies show 90% of the time epidural steroid injections are effective. They're done as an outpatient. They can be repeated every couple of weeks for a series to give maximum benefit, and they can be repeated every few months. Okay? So that should be noted up front, that it's a very successful procedure. But what happened recently was that there is a contaminated source, and most likely, it has not been definitively confirmed, but it's in New England, and it's a compounding pharmacy. Now the question is, what's a compounding pharmacy? I'll get to that in a moment. But the epidural steroid medication, which is called, in this case, methylprednisolone, was contaminated with a fungus. Now, when you inject it in a knee, an elbow, or a hip, it's into the joint. You can get a joint infection from that, but most likely that is not going to go and become meningitis. But when you're doing it around the spinal cord, in the epidural space, it can get into the area underneath the spinal cord, travel to the brain, become meningitis. And that's what happened in this case. There's been about 14 deaths around the United States, and over 170 people have been infected so far. The additional thing is that a dozen states have received the medication and have confirmed cases. Okay? So it's not localized to just one geographical area, it's 12 states, such as North Carolina, Florida has a few. The most has been in, I believe it's Indiana or Illinois, but you know, there's pockets of places that have been affected. I think New Jersey, Michigan has a few. Idaho is the most recent. So they traced it back to this one source, and it's unfortunate, but it happened. Okay? Now, what is a compounding pharmacy? The compounding pharmacy is not the actual manufacturer of the medication. The manufacturers are controlled by the FDA very strictly. They look at every aspect of the manufacturing process, and when medications come out of an FDA-regulated facility, there's very, very, very few issues with contamination. Okay? In this case, the compounding pharmacy in New England takes a medication and they remix it up custom. Okay? Now, there are some pain doctors around the country who do not like preservatives in their steroid medication that they inject. All right? You can't get that right from the manufacturer, so the New England Center actually makes it up custom. And they do a lot of it. I mean, we're talking about 76 clinics in quite a few states, and over 14,000 people receive injections from these two lots that have been deemed to be contaminated. Now, let's look at a state like Nevada, for instance. Did they receive the medication that was contaminated? Yeah, they did, but none of it got injected. It was actually recalled before any of it went into a patient. Okay? So 14,000 people were injected with this potentially contaminated material. And now you're seeing more and more cases pop up. Why is that? Well, there's an incubation period. It's usually 1 to 4 weeks. So right now, all of these patients have attempted to be called, and they're being on a vigilant watch for symptoms. You can get treated prophylactically, these antifungal medications are not the greatest as far as they do have some side effects. Okay, so once again, just to reiterate, no patients at all in Arizona were injected with these contaminated medications. In fact, the Arizona pain specialist doesn't even use methylprednisolone. They use a different medication altogether. Okay, so no worries about contamination. If you are, were, or thinking about becoming a patient at Arizona Pain, don't worry. Okay, the risks of an epidural steroid injection are very, very low, but real. Okay, it's a very low risk of infection. This outbreak has probably had more infections than the whole country in the past year, I think. I mean, it's much less than 1%. It's a small risk of a transient increase in blood sugars. There's a small risk of some bleeding. If you're on anti-clotting medications like Lovenox or Coumadin, make sure you talk to your doctor beforehand. You'll need to stop those, okay? And there's a very low risk of nerve injury. I mean, that's much less than 1/10%, okay? So, purpose of me doing this video is to give an overview of the fungal infections around the country, and two is just to comfort those in Arizona who are worried about an injection they receive or an injection they might be thinking about getting. The fungus did not come in any of the medications to Arizona. All right? Just to tell you a little bit about Arizona Pain Specialists, they have multiple board-certified and award-winning pain doctors and chiropractors at multiple locations around the valley. They serve Phoenix, Mesa, Glendale, Chandler, Peoria, Tempe, Gilbert. Basically, all these locations are fairly centrally placed around the valley. So they can draw from, say, Fountain Hills, Maricopa can come up to Chandler, and you're not going to get care that's better anywhere else. I mean, these are the best of the best. They're all fellowship trained, double board certified, and they do both medication management and procedures, and they have physical rehabilitation, acupuncture, spinal decompression therapy, chiropractic treatment, physical rehab. It's all there under one roof at each location. So call today, one number scheduling at 602-507-6550. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.